the middle of the week. It's a
It's a
Koviki talk
Wednesday
on
in the
Wednesday, right? Oh,
right.
we
That's
got
right.
so much information. We can't
You
contain it
can't
in
fit it
one day a
into one
week.
show, which is true. You just can't.
All right. Koviki Talk is a multi episode series where we talk about all things COVID-19, but from the PI perspective. So we have PIs on here talking about PI things that have to do with our community, but it's mostly important for our people to see us having the discussions and people like Dr. Samoa leading those discussions. So why don't you introduce I think it's his first time ever on our show.
The very first time, like it's we're just honored to have Dr. Raynald Samoa on this evening. Dr. Raynald Samoa, MD, is a clinical research endocrinologist. He has a lifelong fascination with obesity related disorders and has parlayed that interest into research projects and investigating the metabolic. Okay, I should have this memorized because
The
I say it
metabolic.
all the time. Metabolic conditions that affect populations vulnerable to diabetes, such as Pacific Islanders and cancer survivors. Dr. Raynald Samoa received his medical degree from the University of Washington. He did his adult endocrinology fellowship at the Los Angeles County University of Southern California and his pediatric endocrinology fellowship at Children's Hospital Los Angeles. Currently, he is an assistant clinical professor at the City of Hope Medical Center in Duarte, California. Dr. Samoa is also the lead for the Healing Association of Pacific Islanders, the HAPI Doctors, which is an organization under the National Association of Pacifica Organizations, NAOPO. Welcome, Dr. Samoa.
Thank you for having me.
I see we
Yay.
got you at work again.
Yeah.
It's you're doing so much that we're just glad to have you on. We got questions about COVID-19 stuff, and it's a lot of questions that are just in the public that we thought, hey, let's just get them all out there
Mm-hmm.
and talk about the questions that are out there about are things safe? Is it worth getting it? All those kind of things that seems like we answer them kind of, and other people, just need to hear them. So that's what we're going to do today. We're talking about the state of California data. Dr. Samoa has PI data gathered by Pacific Islanders. So, and that's one of the big things we've talked about all the way through this pandemic is getting data that is specific to us and not hearing data that is about the other 90+% of other people, and just talking about us. So before we do that, Naki's got quite the icebreaker question on deck here. I've been looking at this for a while.
Yeah, I forgot to send it
Yeah.
to Reno. Just oopsie, oopsie. But it's a good one, and it's probably I don't know. It's kind of easy, kind of. If you were a wrestler, what would be your entrance theme song? Right? Okay, we'll have Carl go first.
Only fair that I go first because I saw this in the agenda
Yeah.
hours ago and I'm still haven't landed on anything. I'll say that it's not a professional wrestler, but BJ Penn was a mixed martial arts fighter from Hawaii,
Mm-hmm.
and he came out to Aloha Oi, and and I don't know if everybody else got what that song means, especially to Hawaiians. Queen Liliuokalani wrote that song while she was imprisoned in her palace. So when BJ Penn came out to that, there were Pacific Islanders that were like, I got chicken skin. I got like goosebumps when he played that when he came out. So it's not really a professional wrestler song, but I would come out to Aloha Oi because of who wrote it, when she wrote it, and what it means. And
Nice.
like I said, I looked at that question and I was like, I don't, so I've had hours to think about it. Poor Dr. Samoa just gets it sprung on him. Maybe Naki, you could go and give Dr. Samoa an extra couple of minutes to think.
Yeah. Yeah. Okay. So if I was a wrestler, even though we have wrestlers in our family, and I don't like now they come out and they do a haka and whatever. But back in the day, they would do songs. And so if I was a wrestler, it's kind of ratchet, but I like Megan Thee Stallion, her Savage song. It's, I'm a savage, classy, bougie, ratchet. I'm a savage. So I love that song. I know it has curse words kind of, but the clean version of that.
Just got curse words kind of like Naki's got curse words
Yeah,
kind
I
of.
kind of. Dr. Samoa, haven't I been good with my language? I've like cut it in half.
Right. You could actually broadcast us on regular TV. Almost. Almost. Wow.
We're practically G-rated now.
Right. I don't know about that.
Joseph Tomoa said, "I'm every woman" is his is his song if he was wrestling. I like that song.
I love it. Good question, Naki. Good
Yeah.
question. All right, Dr. Samoa, you've had, usually we have a pre-show and then we would give the guests this information. And then we realized that we just spent the pre-show just talking about whatever. And then we get on the show and I was like, he hasn't had any time. Like, this is a straight cold question for Dr. Samoa.
Oh,
But
I've been ready.
what you got?
I've been ready for this question since I was a teenager. I don't know if you two know, but my uncle Mose was a wrestler.
Lord.
Was a professional wrestler in Hawaii.
Lord.
And so one of the songs I would come in with in tribute of him would be Sweet Dreams by
Oh
HAPI,
my God.
right? That's what he came in on.
Oh my God, I can't believe you remember that.
Because I helped him pick it out. I mean, granted, if you didn't know I was gay then, you probably would have figured it out. But the other song I would pick is probably Vi'i o Lauli'i. That's in reference to our home village in American Samoa. And so, yeah, those two songs have special meaning. So I would walk into one of those.
Nice. And for those of you that are watching and aren't aware, Uncle Mose is who, Naki?
He is my baby daddy. He's my baby daddy.
We have so much fun when we're on, and we're talking about important stuff at the same time. So,
That's right.
Great job with the question today, Naki. It was spot on. So we've got some data that Dr. Samoa has gathered, and we've had some discussion points that we're going to talk about specifically California. And we're going to roll through some of the questions because there's such a big PI community in California. I would, probably number-wise, it probably has the most PIs in it. Percentage-wise, Hawaii probably is higher in percentage, but numbers and sheer numbers, California has a ton of Pacific Islanders. So I don't know if you wanted to just talk through it, Dr. Samoa. Yeah. Okay, I will turn it over to Dr. Samoa.
Sure. I know we had a list of questions we want to kind of get through. Do you guys want to go through those, or do you want to go over the data?
Sure.
It's up to you.
Yeah, we can go through the questions because it seems like, and then we can, weave in some data information to back some of of your data up and your answers. As one of the questions we have is, why is it important for the Pacific Islander community to get vaccinated?
Why is it important? It's important because we're dying at it from the highest. We have the highest mortality rates.
Right.
And we continue to have sort of the highest case rates, and so COVID did a number on a lot of our cultural norms and practices, telling Samoans not to gather, not to be around each other. That was tough.
Yeah.
And so as we come back and we want to sort of reconnect, one of the things that I think we have to be responsible for is that safety of coming together again. And so I understand there's a huge part of our culture and salient to our community, but you have, if we're going to do it, let's try to do it as safe as possible. And so the vaccines add an extra layer of safety, and it's one of the few ways, besides like staying home and not talking to anybody, that we have to help fight this, and so I don't understand why we wouldn't be able, why you would have reservations
Right.
in that aspect. I understand there's concerns about its safety and everything, but
Yeah.
in regards to sort of not understanding that part, that's the part I'm still trying to understand from people where that hesitancy is coming from.
Yeah, it's important. If it's important in general, because of the way that our community and
Hmm.
our people have been hurt by it. So if it's important in general, it's even more important for us because we're reacting worse than the average. Worse than the average. Um, one of the questions that's out there is the vaccine effective? Especially since we're hearing there's boosters. That discussion is out there, and so sometimes people will say, "Well, how effective is the vaccine effective if I need to get a booster?"
Right. Um, yeah. So the all accounts demonstrate that the vaccines are a lot more effective than not getting it. Right. One of the ways you can see how effective something is the impact it's having on admissions. You know, um, before the vaccines, we were looking pretty bad.
Yeah.
November, December of 2020. Wow, it's crazy. That's been a year, almost a year ago. Things were looking really dark. It was stark. I lost my uncle at that time, so it was very in my face, and we were seeing it in the hospitals. The health there's a huge shortage of healthcare workers, around the nation, and I think part of it was just people got burnt out.
Yeah.
We were 24/7 dealing with COVID, and when the vaccines came, those numbers started to drop. And there's people that are saying, well, that's because everyone was starting to get COVID, but that's not true, right? Like there were still a lot of people that weren't infected yet, reinfected. That's the other thing too, that people who had COVID were getting COVID again and still getting admitted to the hospital. Um, so the vaccine's efficacy was proven in clinical trials, but also in the real world. Now that I'm only talking about the ones that are FDA approved in the United States.
Right.
Those have had all greater than 70% efficacy in their clinical trials. Um, Now that's not 100%, which means that you can still get it afterwards, but for the most part, it looks like the vaccine helps lessen severity of symptoms even if you do get COVID. So for all those reasons, I think it's to our community's benefit to get vaccinated. Looks like you got a
There,
couple questions in the chat. Yeah.
Yeah, yeah. So we
yeah.
have Teresa Madrigal. Sorry. Why do you suppose there are healthcare workers, including other experts in the healthcare field, that are against the vaccine?
There's a couple. I think the overwhelming majority of physicians and nurses are pro-vaccine,
Hmm.
uh, and you have a very small minority of physicians and healthcare workers who oppose the vaccine. I don't know why. We all went to medical school. We all understand science. We all understand the limitations of vaccines.
Hmm.
And so I don't know why those few physicians are opposed to it. But for the most part, in most places, if you do surveys, greater than 90% of physicians are vaccinated. In any institution, and you're talking about less than 10%, less than 5% usually, that aren't. and there's been a couple cases where people have been excused from their jobs
Right.
because they refuse to get the vaccine, but that hasn't happened that frequently. So, when you're talking about like apples to apples,
Right.
you're talking about the overwhelming majority of the medical community supporting the use of the vaccine, and only a small percentage saying, that they're against it. And I'm not sure. Not sure what the a lot of times it's politically motivated. I understand that. Um, but as far as like having a good scientific reason to be against the vaccine, uh, I I really haven't seen one that's been that formidable. You could use the clinical trial, or you could use some of the safety profiles in some of the early trials to say that, oh, there's some concern, but the vaccine's been given like 40 million times around the world,
Right.
and the complication rate or the side effect rate has been extremely low. And so you pit that against sort of the death rate against COVID, and to me, it's a no-brainer.
Yeah.
I think that speaks volumes for, like, if I'm asked my mechanic, what kind of gas do you put in your car? Well, that's the kind of gas I want to put in my car. If that's the mechanic's putting that in his car or
Hmm.
her car, and it's the same thing. If most of the physicians are in the healthcare industry getting vaccinated, that's kind of the same concept. Like, good for you, then good for me as well. We got some other questions in the chat. I think one of them we're going to definitely get to in one of the questions we have. But Billy Felice Talese is asking: is the data that we go over today just for California, or is it nationwide? And so, if I'm correct, we're going to talk about California today, Dr. Samuel. But you did gather information not just for California; you gathered information nationwide. Is that correct?
Yeah, so it's 1,200 respondents from around the nation. They're predominantly in states that have a higher Native Hawaiian Pacific Islander population. So, or a quickly rising population. So, the predominance of our respondents came from California, Hawaii, Arkansas, Oregon, Washington, Utah, those states, and if you ask any Pacific Islander, one of us has a relative in not, if not all of those states, at
Yeah.
least one of those states.
Yeah,
Right.
definitely. Let's see. Are there? Well, let's ask about the children because that's a big focus right now. And I've heard some of the questions. Will children experience stronger side effects of the vaccine shot than adults? As we talk more about the 12-year-old, the 12 to 18-year-old age range. Do children experience stronger side effects of the vaccine shot than adults in general?
No, I haven't
Okay.
seen any reports that suggest that.
Yeah.
It's the children get a lower dose because their immune system is more reactive. Like they're more likely to have a stronger immune response.
Yeah.
So I don't know if that's the reason why. But I haven't seen a lot of reports saying that children have more side effects. My case control in my house, out of the three, only one had, and the one that had side effects, I don't know. I was like, are you trying to miss school? Like what? I'm a little suspect about that one. But if we're gonna be true to true, a third had side effects, and they were minor side effects.
Yeah,
Fatigue,
and
slight nausea, malaise.
I think that's the point, right? That there can be minor side effects, but the risk of not, the risk of facing more severe symptoms with COVID, the vaccine would far outweigh that.
Yeah. Yeah. So, can the vaccine affect my child's development or fertility? Because I've heard that a million times too. And is that,
Um,
yeah.
I'm
And do we
not.
know anything about that, right? Because the vaccine is really,
It's relatively
new.
new,
Yeah.
right? But the development and the fertility issue, is basically trying to draw upon any new drug. Um, and it's very unlike unlikely based on how vaccines work, you know. So there's a lot of talk about like mRNA.
Yeah.
Let's be really clear, this is not a genetic altering medication or drug. It has no play on your genetic structure, or what it does do is it incites your immune system. And so its job is to sort of promote immunity by getting the right cells to be activated, and they do that by just introducing the antigen, which is supposed to look like COVID. People have been trying to get bogged down in the technicalities and the weeds, like, oh, it's an mRNA vaccine, that must mean it must change your DNA. I don't know how an mRNA does that, like that's it just doesn't do what people are claiming it does, that aren't really informed.
Right.
And so I don't see how it would do that, because what you're asking is, does it have a play on genetic hormone? I mean, growth hormone.
Mhm.
And growth hormone and the immune system, although the immune system can be infiltrated in a lot of things in regards to chronic inflammation, but how it plays into the secretion of growth hormone, and that's my field, that's endocrinology. I don't see how that happens. And then what was that? Your fertility is my field too. That's endocrinology. You're talking about it invading like hormone production. I don't see how the immune system would do that.
Awesome. Awesome. Thank you, Dr. Samoa.
Yeah.
We have Teresa who has another question. Today, the news mentioned a fourth vaccine shot. Is it because the efficacy of the booster has decreased? And are we looking at more shots?
Four. There's like seven.
Oh, wow.
Right. There. I mean, there's the top three that are FDA approved, and then there's one that the FDA is kind of looking at. Um, these are not. These are not. The shots don't differ that much.
Hmm.
There's some sort of some smaller changes within each like vaccine. I don't think it's driven by the need for another vaccine. I think it's driven by the market, right? And so COVID is a hot issue right now. So of course the drug companies are going to try to capitalize by pushing out, their product,
Right.
because it's the highest need. Because I don't think the FDA was like looking around and say, hey, we need more vaccines because the booster isn't working. Also, the efficacy of the booster isn't really fully evaluated yet.
Right.
Like we only really started recommending the booster a couple months ago. It's not so much that, and I think what the question, and Teresa, if I'm misspeaking, please clarify. The efficacy of the booster question is really asking, why do we need a booster? And so the thing about this particular strain of viruses, the coronavirus, the corona family of viruses, is that no one knows how long our immunity lasts against them, right? And so we do know that it's closer to like the flu, the influenza viruses, although not exactly the like. And so influenza viruses, what do we get? We get a shot every year, right? Because the strain changes so much. I think that's the thing that's kind of happening with why we are needing boosters, is because the virus is getting enough time. Its presence in the community is so high,
Hmm.
it can mutate. It can still cause. It can still be different, where immune system doesn't fully recognize it, so you'll get a reaction, even if you're vaccinated. And
Right.
so, how does that play into currently? It means that we need to get rid of we need to lower the prevalence of the viral infection, which means we need to get vaccinated.
Right.
One example is like polio. right? I think it's safe to say that we all got polio vaccines, right? There's like a very, 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 very small percentage of us that
That
haven't been
didn't. Yeah.
vaccinated, right? And the reason why we don't need a booster that often with polio is because we all got the shot, we all got
Yeah.
immunized, and so it doesn't have. There's not a lot of chances for it to mutate and cause a different strain to come back. And so the longer it's out there, the more it's going to mutate. The Delta variant is out right now.
Right.
The Mu variant is out in parts of Australia, and then there's another variant that's being I think it's like circulating Europe. They haven't fully identified it yet or called it a different strain, but that's what we're going to continuously deal with as long as we have a high percentage of our population that won't get vaccinated.
Right.
And people are trying to tell me to go home now.
I know.
I think that plays into the question of like if my child already had COVID-19, do they still need to get the vaccine? And I don't think this is necessarily just a child question. I think this is a question that's out there. If I myself or my child has had COVID-19, do they still need to get the vaccine?
They do recommend some time of recovery after getting COVID-19 um, uh, before you get the vaccination again.
Mhm.
Um, I think one of the reasons it would be a good idea is because you don't know what strain your kid has, right?
Right.
If you had the normal strain or the regular strain, um, uh, you're and you get exposed to the Delta variant,
Mm.
it's hard to say, whether or not how severe your symptoms are going to be. Um, but if I know it's also really hard to sort of determine immunity from active infection. Um, and so those questions are extremely valid. You know what I
Right.
mean? And I would talk. I would use your medical resources. Talk to your pediatrician. Talk to your primary care provider. See if in that situation whether it's a good idea or not. Now,
Right.
definitely, if you're immunosuppressed and your health is compromised or your child's health is already compromised, then definitely I would think that they would recommend the vaccine. But if they're not, I think there's some room for discussion about whether or not a vaccine would be a good idea. Although most pediatricians would probably recommend that you get it.
Yeah, I would think that like if I had like Naki's had COVID-19, right? So does she have immunity going forward? Well, it's hard to say, and it's hard to say whether your immunity for that strain would be effective for another strain. But
Right.
the vaccine is effective protection for all of the variants out there right now, right? Not 100%, but that would speak to that you would still need to get the vaccine for that layer of protection, and it would help. Whereas if you didn't, you don't know if that immunity is going to be effective for a different strain. So the vaccine right now is believed to be effective against any of the strains. So that would be a safer bet, I would think.
Yeah.
Yeah, it's the reason why I think we're looking at boosters mostly is because we still don't know what our immunity is. We don't have any good studies to show how long immunity should last with coronavirus. And um, it's I think that right now, like the booster is being offered to hedge our bets,
Right.
and that's why the criteria um, is basically aimed towards those that are at the highest risk, of recurrence. So, the current criteria is I think the CDC modified it a little bit, but
Mm.
the most recent ones are, older than 65 years old. If you're over 18 and you live in like a long-term care setting, if you have any underlying medical conditions, or if you live and work in high risk settings, and so hospitals, right? I think Lily said she got She works. She
Yeah.
a booster,
Uh,
and because she's in that criteria.
right. She received her booster, and while she had waited 30 minutes afterwards, noticed there were people that were walk-ins without appointment, but were told they did not meet the criteria in order to receive it. They were arguing with the health personnel. So
Yeah, it's. I mean, the criteria is the criteria. And so I don't know. It's well, one, I'm happy people are going to get their booster. I'm
yeah,
sad that they're getting turned away. Um, and so it looks like other people have got Melody. Melody
mhm,
got vaccinated in San Jose. Uh,
yeah,
yeah, and so yeah, I just got my booster 2 weeks ago.
right.
Um, and yeah, I had like minimal symptoms compared to the first 2 times I got it. But yeah,
Yeah, and so you have to have meet one of those criterias in order to get the booster. Um, but eventually it'll open up to everyone, right? Just
that's
like
what I think's going to happen.
I think
And
so too.
so yeah, the other thing that we have to be very grateful for is that the profile, the efficacy of the FDA approved vaccines is really good.
Yeah.
If you look at the ones, the vaccines that are from China, AstraZeneca, I mean,
Mhm.
there's some studies that show that it only has a 20% effectiveness rate, right? And so, I'm like, okay, those people have a legitimate beef, right?
Right.
If that's the vaccination, and unfortunately, a lot of our countries of origin, like Samoa, um,
Mhm.
they have to use the Chinese donated vaccine, and so I'd be really hesitant. Although all the United States is, affiliated Pacific Islands like American Samoa, Guam,
Right.
a lot of the Kofa nations, um, Saipan, they their community health clinics are obligated. They're mandated actually to use the FDA approved vaccines. So uh, that I'm happy for that.
Right. Right.
Along the question of another vaccine being approved, can you talk a little bit about the process of being using an emergency use versus being fully approved? Because it seems like if other companies were in that pipeline, we're going to continue to hear about other ones as they get approved. But it
Mhm.
doesn't mean that the ones that are out there are uh, not efficient or the efficacy level is low. It has to do with when things get approved. Can you kind of talk through the approval process?
Sure. So the emergency use is done in dire situations like the pandemic. Um, but now that there's vaccines out and they've gone through full vetting, because like I said, we're going on close to a year now since the vaccines have been out, and the FDA's granted full approval for both. Pfizer and Moderna, um, uh, they no longer fit under the emergency use approval category. Um, now now that we have vaccines, though, I don't think any other vaccine can go through the emergency use approval route. I could be wrong, but I don't think they can use that mechanism now that we have options and we have experience. So I think all like subsequent vaccines now will have to go through the regular approval process, which is a lot longer. So even though there's a fourth kind of mulling around, I don't know how soon they can put theirs up unless they were already approved to go through trials, um, and have been collecting data all along. Um, it may be some time before those are fully recognized and given approval.
I think some of the as we move to focus on the youth, it's kind of the next step and that's the one that we're in. Some questions have been out there about what steps were done to ensure that it was safe for the youth to take. Can you speak to anything, even if it's just the clinical trials process, because that would be, a portion of it. But can you speak to anything in terms of safety for
Mhm.
the youth vaccine?
So just like the adult versions of it, they had to do uh, phase one, phase two, phase three clinical trials. And so each one that they did, they recruited participants. Although I don't know how well they recruited for communities of color, um, uh, but supposedly the side effect profile was reassuring for them to garner the at least the approval, the emergency use approval, um, and I think because of that, because of its reaching approval, a lot of school districts have moved to, or schools period have moved towards sort of mandatory vaccinations, which is getting a lot of pushback. Um, and so, that's where that comes from.
Got it.
And just curious, as you're talking, would that be where, like the clinical trials, would that be where they came up with having a lower dose for the the younger people, or would that be have been something that they put into the clinical trials to try?
Well, I think like they patterned a lot of their clinical trials from previous vaccines, and that's a standard thing that they do with vaccines is they give them a smaller dosage because, like you said, like I said before, children have stronger immune systems usually. So little goes a long way with them. Um, but as you get old and tired, your immune system starts to go down, and then you have to get your boosters when you get older.
Got it.
Yeah, I was looking at the vaccine was approved for ages 16 and up last December, and ages 12 up in May. So that's millions of people. That's real world. Um, there's real world results there to look at as it being safe. I don't know if now's a good time to go through the data
Sure.
that we gathered, but we can come back to the questions that are in the chat when we get done sharing the data.
Okie doke. Let me pull it up. Yeah.
Mm-hmm.
Give me one sec.
Naki's thinking of her next icebreaker
Well,
question.
actually, 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 Mosa is texting me saying Reno did pick that song for me coming out. I was like, "Do you mind? I'm doing a show here."
I That's how much I love my uncle. I was like, he listened to, what was I, 12 at the time? He listened to a 12-year-old. Let me see. Can you see the screen?
Yes.
Yes.
Okay. So this was the report that we showed based off needs assessment. Dr. Nia Toto and myself were in charge of the Pacific Islander data, and we were lucky that we had a very strong network of community-based organizations, which these are all a lot of these groups were merged together to form Naopo because of a lot of success that we had in working together. Like I said, we had over 1,200 respondents from across the nation, primarily Samoan. There was a lot of smattering of other ethnic groups, and the Native Hawaiians were being surveyed by the Indigenous Research Wellness Center from University of Washington. And so in the nation, we found that 46% of NHPR were hesitant to receive the vaccine. And when we broke that down by states, the highest rates were in the red states, which is kind of common. We see that in the general population too. Arkansas had the highest vaccine hesitancy at 71%, Utah at 64%, and then it goes down. Um, as you go west, um, with the lowest rates being in Washington, 25%, and that kind of mimics their vaccination rates now. Um, and then this is kind of where we're seeing some of the root causes. When we look at people who are hesitant to get the vaccine, and we kind of break them up into educational attainment, you can see how the more education you receive, the more likely you're going to get the vaccine. Same thing happens when we look at income. Um, the more you make, the less likely you're going to be hesitant about the vaccine. The less you make, the less likely you're going to get the vaccine. And then there were some other kind of interesting things that we found from the survey too, and that everyone across the board, no matter how you sliced it up, was having problems seeing their primary care provider or their healthcare provider. Before the vaccine in blue, you can see anywhere from like 18% to 45% had difficulty scheduling appointments for their doctor, whereas during the pandemic and after, it is 2/3 across the board. This is a problem when you have a group that already has high incidence of COVID, because this is delayed care, and delayed care we've noticed increases your risk of dying from COVID. So when we looked at the California data, uh, the breakdown was primarily Samoan again. We had about 300 respondents from California, mostly middle class. They're predominantly Polynesian, and only a small percentage had bachelor and graduate degrees. When we broke the data down by county or zip code, we noticed a couple hot spots. The Inland Empire had a huge hot spot when it comes to vaccines. There was a lot of hesitancy to get the vaccine in the San Bernardino County and also in San Bruno, which we had talked about on a previous cast. Um, the vaccine hesitancy by income and education level plays about the same in California, whereas the the more you make, the less hesitant you're going to be, and the higher your educational attainment, the less scared you're going to be of the vaccine. This is just sort of this in picture format. So this is a striking thing right here for me. For people who listed just having in high school or a GED equivalent, they're 89% hesitant to get the vaccine. Compared to only a third of people with graduate degrees that were hesitant. Um, you know, and then more than half of those who made less than 25,000 a year, almost double that of those who made over 100,000 a year, were more afraid of the vaccine. And then, so what that pulls together is what we call the socioeconomic. The socioeconomic health gradient. So you can replace COVID with diabetes, heart disease, cancer, and you see the outcomes are pretty similar. Those who make less and have lower educational attainment, they just happen to do worse. So the question is, how do we make up for that gap? And so I think that's what caused us to go from the response team,
Yeah.
to merge our talents and our resources together to become the nation of Pacific Islander, actually it's Pacifica organizations, or NAUPO. Um, and so that this is kind of the breakdown of the essential workers. Uh, Luckily, the it's about half, actually more than half,
Right.
of essential workers that are hesitant to get the vaccine. Um, and you compare that to sort of um, essential workers. Actually, I think this is probably the same thing. Um,
Yeah. And because we're like most of Pacific Islanders are essential workers, should isn't it like that's even a bigger reason why we should get vaccinated is because we're working during the pandemic. Like a lot of PIs continued to work during the pandemic because they were essential workers.
Yeah, yes, and and I think that's the thing about the essential worker age group. It's
Hmm.
about 25 to 44, 25 to 64, and that group is what I call like the invincible group. That's the group that, what, I'm going to survive it, I'm going to do okay. And they get COVID and they come home and then they give it to your
Grandmother, your
right,
mother, right?
your family member with cancer, and then you went from it not being such a big deal to now you hit somebody that's at high risk.
Right.
Um, and
Because
so
we live in multi-generational homes, we said that throughout the pandemic that
yeah,
because we live in multi-generational homes,
right,
it's so important for everyone in the house because of your grandmother or your mother or your aunt or the elders that are living in the house. I think that's why we really stress for our PI community to get vaccinated is not only thinking of yourself, but your mother and your mother.
right, yeah. So my kids were vaccinated not because I didn't think they were at great risk,
Mhm.
health wise,
Right.
but I knew their grandparents were, and my
Yeah.
mom's a cancer survivor,
Right.
just like you, Naki and Carl. Um, and if something happened to my parents, my kids would feel horrible. They would
Oh
feel
my gosh.
awkward, right?
Right.
And so, part of they're getting mostly the drive to get them vaccinated is so that they can be around their grandparents.
Right.
Um, and so I think that's the thing that we have to realize that it's not just you that's getting vaccinated. You're doing it to protect, not just your family but your community. Um,
Right.
and so it's that's the part that bumps up against a lot of the political rhetoric. You got a lot of people spreading misinformation and fear um, for political gain, but what I'm hoping, what I lay in night trying to stare at the ceiling hoping happens is that fear and rhetoric that you're being exposed to exploit you politically. I hope that the wisdom of our culture, the foundation of our commonality, our roots overcome that, right?
Right.
The the duty to our community and our families and our people. I hope it's louder than the noise that comes from those who profit off of misinformation.
Right.
And so I don't know. Maybe I'm an optimist, or but that's what my hope is.
Yeah. I think the thing for me with that I automatically assume is that Pacific Islanders think of their mom or their dad and their grandmother because our elders are our treasure. They carry our history and they can tell, they tell us everything about our bloodline. And I always think that Pacific Islanders treasure the elders that you would get vaccinated to protect them. And I think, like you said, now it's I'm glad that now that when I see invitations to stuff, and we had a bridal shower recently, and my kids stressed, online, if you're ill or have anything, just please stay home. If you have to be masked, please get tested too. I mean, there's a big paragraph that comes with invitations now is please wear a mask. If you're feeling ill, please stay home. Please get tested before you come to the event and have a positive. I mean, and I know it's a lot for PIs to handle, but it's actually we're trying to save each other's life because of the death rate was so high among Pacific Islanders. And so I encourage people to get vaccinated. Of course, it's your choice, but The numbers that you see on CNN and TV, and we say this almost every week, they're not talking to you.
Right.
They're not talking to you. Those are numbers not geared towards Pacific Islanders. We have to now Oppo and the PI, COVID response team had to disaggregate. We disaggregated our own numbers to get pull numbers for Pacific Islanders. So listen.
I had a question about bad math, right? I mean, you had talked kind of about that, about not being able to schedule your appointments, and then all the other things. That's bad math, and the outcome is the numbers that we're seeing. As an endocrinologist and a diabetes specialist, do you see the same bad math in with other health concerns, like a bunch of different layers to the onion that need to be peeled back? Was
Oh
was
yeah.
this
Mm,
Oh
the
yeah.
same as?
We not bad math, absent math. Like trying to get a diabetes prevalence in a county for Pacific Islanders is ridiculous.
yeah.
It is so difficult. Um, and then there's people that say, we have surveys and stuff. It's not the same, you
Yeah.
know, because surveys are you're only the people that know that have diabetes can report that they have it. The ones that don't have it, which is a fair amount, you'll never know. And so we don't get information regarding sort of not just presence of diabetes, but risk for diabetes. Nia Toto is leading like an assault on diabetes prevention
Yeah.
because she's trying to push DPP throughout. Um, but one of the things that's going to plague us is trying to get numbers.
Right.
We don't have numbers on screening very well. It's hard for us to sort of mount any of those types of numbers because the system's just not set up for us. you
Yeah.
know and I think people have just gotten comfortable with the idea that it's okay if we don't have numbers. The problem with that is then we don't get resources, we don't get services, nobody listens to us. And so we're changing that narrative, we're changing the acceptance of that excuse. And so yeah, I think having these conversations and showing up in places, uh, you know, I think that's what the pandemic has offered.
Yeah.
I had a mentor that used to say the darkest night brings about the brightest stars. Yeah.
Mm.
And so I'm hoping in the tragedy of the pandemic and the misery that we all experience with the loss our community has endured,
Mm.
that we push forward with things that are better than when we started.
Yes.
That we have better screening, that we have better diabetes prevention programs, that we have better access. And so that's what I hope. Looks like Lily asked a question.
Yeah, Lily has she says, Dr. Samoa, why haven't they involved the churches in making and pushing through the information regarding the COVID-19 and the boosters in the Polynesian community?
We we
They have.
we have we have. Thank you for bringing that up, Lily, because I have to tell you, a lot of the misinformation is spread to our churches.
Mm.
You know, I had an hour conversation with my uncle from Hawaii, who's a pastor. He's a koinga
Mm.
for their pulenga down there, and you know 30 minutes he spent trying to explain science to me, and I'm like, because
And he had COVID.
and he had COVID, and he almost died of COVID, and trying to explain sort of his understanding of science to me, which, at the risk of sounding arrogant, I was like, you're not talking science to me. You're basically telling me your political view. Those two are not equal. And so it's tough. It's tough to get them to buy into that whole idea.
Yeah.
And so we continue, but we have to. I don't think there's a lot of movement without the churches. So headaches and everything, we still have to push through and work with our spiritual leaders, because we don't have villages, we have churches.
Right.
And so we have to figure out how to move forward. I know there's a grant that we're looking at, applying for, um, to try to get more testing, um, in the Pacific churches. I know, like, Samoan churches especially are a hotbed for COVID transmission.
Yeah.
So we're trying to figure out what kind of testing is feasible, during those church functions and events. Um, and so, we know that if we go in there with an approach that's not informed by the community, we're going to fail.
Yeah.
So you have to start with them. You have to start with going, what's feasible? What can you do? What's a no-go?
Yeah.
And so that takes money and time and resources. So we can't do, as much as I would love to try to do that, without all the bureaucracy of research.
Mhm.
It's just not, I don't think we can. So yeah, so hopefully, fingers crossed, we'll get that grant and be able to do it.
I think the if you just answer the question, why haven't they involved the churches in making the push and the information? They haven't, because they don't understand how our community works. Like, the mainstream is not going to do that. We've got to do that. And that's
Yeah.
things that, the PI media, PI, doctors, health workers, those kind of things. That's where we need to push that. But the short answer why they haven't, they don't even know how it works. Even if they had $10 million to do it with, they do it on CNN, or they do it in a
Mhm.
way that doesn't reach us anyway. So the short answer, they don't understand us. And
I
then you're
Yeah,
right. We do need to go through the churches.
I there have been a lot of money given to engaging communities,
Mhm.
and there have been some academic institutions who have, tried to work with Pacific Island communities and have gotten zero back. Like, I don't see not one publication or one report aimed at Pacific Islanders
Right.
coming from those collaborations. And it's because they came in with the mentality that they have a structured way to do things. They're just going to have people in the community do it.
Do it.
And that's just a recipe for failure. So they had to learn. It took them a lot of money to learn it, but they learned it.
Right. 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 Awesome. Thank you, Dr. Samoa. So, any last, I know we're going to try to let you get home and get out of that office, but um, are there any last words of encouragement you can give our community to get out there and get vaccinated if you haven't?
Uh yeah, uh I know you probably aren't listening to sort of the science of it and the data, because if you had, you'd probably already gotten the vaccine. What I'm going to appeal to is, uh, that part of you that can listen to where you get your information from, you know, and the misinformation and the, um, sort of, lies, if you will, there's being spread really, really loudly because they're playing on fear.
Yeah.
And what I appeal to you is to use your traditional resources to fight fear. There was a lot of things we didn't come here with, and there was a lot of things for Pacific Islanders and Samoans to be afraid of. What we used against it was our ability to show up for each other,
Yeah.
to care for one another, and we weathered those storms. Right? We built churches, we built communities, despite having nothing. And that's what I ask for you to sort of appeal to. who in your community would be there if you got sick? Who around you would show up, or answer your questions if something happened to you? And listen to those voices, and that's what I would hope uh, people would start doing.
Exactly. Thank you, Dr. Samoa, for your time. We always appreciate you coming on when we beg. When we beg. We appreciate you. We know how crazy busy your schedule is, so we appreciate you coming on and answering questions that our community has, and make sure that they get accurate and timely information straight from the doctor. I didn't say horse's mouth. I said the handsome doctor, our handsome, happy doctor. How about that?
Our happy doctor.
Our happy doctor. Thank
My
you, Doctor.
pleasure.
Thank you, Dr. Samoa. We're here. This week we had a special edition on Wednesday with Dr. Samoa, but you'll find us again, Koviki Talk, Monday at 5 p.m. right here on the Facebook channel or our YouTube channel. And then again, stay tuned for more accurate information about COVID-19 geared towards Pacific Islanders. Have a good evening. Good night, Melody.
Good night, everybody.